Hello, I'm Dr. Bridget Nash, and I'd like to welcome you to The Therapy Show, a podcast series that seeks to explain leading forms of psychological therapy in a way that is understandable to everyone. Today, I am honored to welcome Dr. Tayyab Rashid, who is a licensed clinical psychologist at the University of Toronto's Health and Wellness Centre. For more than 15 years, Dr. Rashid has worked with individuals experiencing complex mental health issues, including severe depression, debilitating anxiety, borderline personality disorder, and suicidal behavior. In addition to maintaining an active clinical practice, Dr. Rashid has conducted important research in the field of mental health. I encourage you to read Dr. Rashid's book, Positive Psychotherapy, which he authored with Dr. Martin Seligman, and is considered the most comprehensive book in the field since its publication in late 2018. Dr. Rashid, can you start by telling us a little bit about your personal background and professional development that led you to the field of positive psychotherapy?
My personal background, you can read on the bio, but I think it's much more personal background that I can tell you from experience, which was almost transformative. I was doing my externship beginning of this millennium and around, I think, 2002 and 3 at an institute in Brooklyn, and I'm interested in yoga. I taught a yoga class and I finished the class, and gently I was meandering towards my car, which I've leased, a newly leased car. Very soon I found myself carjacked by two young men who were asked me to give them everything, and one of them was driving, and within 5 minutes they crossed a couple of red lights. Amidst the panic attack, perhaps yoga helped me to center myself. And I said, look, you have everything. If you want anything more, here it is. And I gave them everything. And if you cross the red light one more time, I knew this part of the Brooklyn was heavily patrolled. So this joyride may be cut short into a chase. And they first welcomed my suggestion with some colorful language, and after a while I noticed they slowed down. I slowly engaged them into some talking. I don't think so they will ever hijack another clinical psychologist. I was a graduate student then. I said, what are you good at? And this question came because I had just started doing my dissertation, and my dissertation was on character strengths, the ingredients which make you and I and everyone else the humans we are. Not perfect, but all of us have some degree of strengths. Yes, we have problems, deficits as well. So they again gave me a couple of answers initially, and I said, absolutely, yes, you're good at that, but not, and I cannot repeat those here, but what are you really, really good at? The things that you might be proud of. Rather than responding to me, one of them, these are the days when we had disc, they just took a disc and popped in the disc player, and they said, we are good at music and you are going to dance with us. With, mind you, there's a gun they had placed on one of my ribs, one of them in the back seat. So with a gun on in my ribs, and they put an inverted baseball cap on my head, and three of us, including the driver, are grooving. And very soon, I think my panic changed into some sort of a calm, and I sort of resigned, okay, whatever my fate is going to be. From dusty streets of Pakistan, where I was born and raised, to perhaps I'm going to die tonight on roads of Brooklyn in a car chase. But surprisingly, after 45 minutes of dancing and a couple of other quote-unquote fun activities, they left me at a dark corner. Police found the car next day. I was so apprehensive because my laptop with my doctoral dissertation data was in the back seat in the trunk. Nothing was touched. Nothing was touched. And I've told the story many times. Even I recount the story. I think that sort of firmed my belief that we do ask wonderful questions to our clients in psychotherapy, but perhaps one of the most important questions about their goodness, about what makes us human being, we don't ask. And ever since 2002, maybe 17 years later on, I've been asking this question from my clients. Just yesterday, I had clients with suicidal ideation and many other complex issues. And after doing all the due diligence which we clinicians need to do, some here I tucked in this question subtly about their goodness, about their courage to come for treatment, to seek help. And it shifts the dynamics, Bridget, so both subtly and powerfully, both for the client and for the clinician. So I think that affirmed my faith in positive psychotherapy, and that's what I've been doing.
So you ask them, what are you good at?
I think a simple question, and I don't know where that question came from. Just asking that question changed the whole dynamics of the situation.
So how would you briefly explain positive psychotherapy to a non-professional?
Kind of a therapeutic arm of the contemporary and very popular movement of positive psychology. We have positive education, positive workspace, positive health. This is more of a clinical sort of arm of positive psychology. Let me make it very, very clear. By positive psychotherapy, it's kind of a little bit of a misnomer. I do not at least say that rest of psychotherapies, CBT, ACT, DBT, and many other wonderful, well evidence-based treatment protocols, they are negative inherently. They have their own values. Why we put positive and psychotherapy together, I don't know. It might be just because everything we were doing was in positive psychology had the word positive. But in essence, positive psychotherapy for a layperson is a treatment approach, is a way of engaging in a therapeutic discussion, in a process where we both, client and the clinician, systematically, in a more structured way, amplify the positives, positive emotions, character strengths, meaning, positive relationship, and things which are sort of intrinsically motivating for us to accomplish. So, because the notion behind is if we increase our positives in our daily life, we do not have infinite resources of attention that we can have a lots of negatives and positive at the same time. Negatives encroach, they reside, they overpower our mind much more powerfully, and they occupy a lot of space. For a layperson, I would just request them that yes, they are going to be there because of historical evolutionary reasons, but let's make an effort to also gently make room for positives. So basically, for a layperson, it is refocusing your attention and your effort to bring more positives, genuine positives, to either manage the negatives or to somehow mitigate them in one way or the other.
So when and how did you realize that positive psychotherapy would be an effective form of therapeutic intervention?
I was at University of Pennsylvania doing my pre-doctoral internship in the counseling center. I was lucky to be there to do my clinical training. Dr. Seligman is also there. So as soon as I was matched to be there, I contacted him and I said, I'm there. I would like to volunteer in your lab. And he was very kind. And then I volunteered for a year. And during that year, we were just forming ideas about how positive psychology can be incorporated in various domains, from education to health. Dr. Seligman, we call him Marty. Marty said, Tayyab, would you like to do something in clinical domain? Wonderful, heavy, very persuasive voice. And I said, well, let me try. We did a randomized control trial where we assigned clients to PPT, individual, as well as we ran a group. And then treatment as usual plus medication and PPT fared well. It was a small sample pilot, and I was a therapist. So even though results were very encouraging and promising, I still felt that, it might be my own zest and passion and commitment for positive psychology that might have brought the results. So it took me from 2006, when we first published the study, until last year, until 10 plus randomized studies were done by other on this protocol. We developed a protocol who found similar results, effective results. And then I sort of started believing I'm a therapist at heart, but a hardcore scientist in my head. So if I don't see evidence which is produced by myself, but also by independent people who are absolutely not related to me, I'm not going to believe my own finding. So when I saw multiple lines of interventions showing results, then I started believing, yes, there is some therapeutic efficacy in this.
So, who is positive psychotherapy most effective for, and why should people choose a positive psychotherapy intervention?
Our initial studies were done with depression. And as you know, when someone is depressed, their worldview becomes very bleak and they think low of themselves. They look at the future. That's sort of a cognitive model. The future looks very dark to them. There's a sense of hopelessness. Our initial studies, a number of studies, have tackled depression through positive psychology interventions because, first of all, we do not, in this approach, minimize, deny, or ignore symptoms of depression or any symptoms. We acknowledge and empathically attend to them. But at the same time, the person who is depressed, if you gently nudge them to explore or help them co-create a therapeutic milieu where they are able to look at their intact side, or something even small one, it gives them the glimmer of hope that their worthlessness can be encountered by those assets. So you're basically reinforcing or accentuating or amplifying their inner resources. You're not coddling them with the catchphrases that you are the best and you can overcome anything and everything. Not kind of as the cliched self-help movement kind of statements, but very realistic statements. Lots of work in the beginning of the treatment is done with depression and many other disorders as well, in exploring the intact sides from the past, how they have overcame challenges previously. Most people have overcome one challenge or the other. So that brings out the self of efficacy. And then slowly and systematically, you cultivate positive emotions to lessen the impact of negatives. How you cultivate them? You ask them and you do them in the session. What things went well for you in the past week? And they can be very small things. And I'll give you an example. I had a client depressed and socially very anxious, and the therapy was in the first couple of sessions was going nowhere. They would not make very much eye contact. And I listened to their story of distress empathically, and gently I asked them, is there anything they ever felt they were proud of? They said, no, there's nothing. And I said, well, let's call them Johnny. Johnny, if next time when you come around, think about it. And when you come, either write or reflect. And if something comes up, maybe we can discuss it. Sure enough, they came next session and they written a quarter of a paragraph that goes like this, that I was a shy kid, always have been shy, but I was very good in athletics. I was selected for my basketball team in the high school, but I never could muster up the courage to put my hand up to be on the front lines to be selected. I was always like a backbencher. One time our team was losing, and it was like a playoff game. One of our key players got injured. Another person was not available, and I was the only one who could replace. Coach has no choice, and he begrudgingly looked at me and cued me to come on court. And I had almost like a panic attack and 1,000 eyes, and they wrote 1,000 eyes were piercing. I scored 3 points in the entire season. I mustered up the courage and scored those points despite everyone looking at me. But those 3 points were enough to take my team to the next round.
That's incredible.
The story was so moving, and they still are not looking at me. It was so powerful for me to hear and for them to listen to themselves that I started believing that there's a variety of issues this approach can deal with. So now we have studies where PPT based or PPT protocol based approach has been applied for anxiety. Someone actually have done studies and applied some of the exercises of PPT for an impatient suicidal clients. Someone in Iran did a study using the protocol with women who had a depression due to infertility. And I have done a study here at my university for 3 years, and very difficult, challenging study where we randomly assign clients to PPT and to DBT. And PPT did decently well, not as good as DBT because the clients had borderline issues, but decently quite well. And then one of the largest study of PPT was done in King's College, UK, where they modified the protocol and trained the service user in National Health Service in UK for patients who had psychosis. And PPT did significantly well on all the indicators compared to treatment as usual. I still believe the stock of studies is small, results are promising, more research is needed, but I have a cautious degree of optimism that if refined, this treatment can help a number of disorders.
And I like the way you distinguish it from self-help and the power of positive thinking, because you're looking at the science behind this modality and you're testing it on actual clinical patients.
Yeah, because I think it will be far easier for me to just tell my clients, do 3 positive things, hug a tree, be you're the best person like a snowflake. 3 in the morning, look yourself in the mirror and say 3 positive affirmations. All those things which sound nice, but they are not effective ultimately. So it will be far easier for me if I just focus on positives, either the superficial or even just the more deeper positive. It'll be far easier for me to focus on just negatives or symptoms or disorders, because there is a very, very compelling science for almost 20 plus disorders and conditions through APA's, evidence-based treatment clearinghouse, that we can treat a number of disorders fairly well by aggressively and then assertively encountering the symptoms. I think, Bridget, the challenge is to integrate both the negatives and positive in a one treatment protocol. I find it exceedingly difficult challenge, but a challenge which I think brings us towards the wholeness of humanness. I mean, human beings have strengths and symptoms. They have weaknesses and vulnerabilities. Most of us hold grudges, but most of us are also grateful for things. There's no one who doesn't have any conflict with others, but there's no one also who has incorporated with anyone. So I think combining these, integrating this in the fabric of therapeutic healing is challenging.
So my next question is, what's the average length of treatment for somebody working in a positive psychotherapy intervention?
The treatment protocol is 14 sessions, and I have most successfully or most, let's say, effectively used it in group settings, because group allows us to listen to others' experiences, normalize them, and also listen to others' strengths, and to then believe ours, or others spot our strengths and acknowledge, and sort of is a wonderful thing that happens in groups. But not everyone is amenable or open to groups. So when I'm doing in groups, I've done 8 to 12 to 14 sessions. 8 are the core ones where I would start with a narrative of resilience after listening to whatever challenges they are experiencing, gently moving them towards strengths. And then the middle part is looking at the negative memories and how they might be hurting us. Then the person about whom we hold those negative memories, and then move towards relationships and meaning. So you could do core exercises and themes in 8 sessions, either individual or group. But the full length of treatment where you explore all the nuances of yin and yang, let me call it, yin and yang of our personality, of our existence, it takes a while. In individual therapy, there's no sort of length because you always meet where the client is. I try to meet where the client is. And sometimes I do exercises with themes out of order because that's what they need. I cannot force a gratitude exercise on someone who is having a very rough week. Likewise, if they have gone through a trauma, I may not do the exercise on post-traumatic growth. So the exercises or the themes or the topics need to be adapted to the idiosyncratic and therapeutic needs of client.
What skills, habits, or tactics can patients and therapists adopt, either during their sessions or in between sessions, to improve the effectiveness of positive psychotherapy?
I think the most important skill, which we all know, is our ability to relate with clients and our ability to sit with their pain, with their distress, which in itself is a strength for us. It's a therapeutic strength of empathy. So if you don't have sort of a bedrock of empathy and confidentiality, no matter you're doing CBT, PPT, or ACT, or any treatment, you are not going to be very effective. So I would say that's probably for all treatments. But more than that is your own belief, your own conviction that human beings are not just products, are not just combination, not just conglomerate of symptoms, deficits and injuries or wounds. We have to look at our clients as therapists, as clinicians, in a different way, that the person sitting in front of me is not fundamentally different from me. Yes, I may have some skills, but they also possess a number of strengths. It is my job, or it is to create a therapeutic environment where we could elicit, where we could organically let those strengths unfold in the room. And when they unfold, the room lights up. The skill is not to ask a lot of questions, but to go deeper with a few questions and elaborate. It's not inquiry, it's the elaboration of experiences. Once you elaborate, then you can find somewhere a string, a path, even a sliver, a silver lining of strength, or something they did well. And then that's the piece which you want to pull other client, a young person, and they had experienced lots of trauma of all sorts. And I said, how did you deal with this trauma? And they said, I didn't deal with it. I actually escaped. And I did this, and which in our therapeutic language we'll call a negative coping mechanism. And I said, yeah, but you're sitting in front of me. And that was, I think, the point where that sort of shifted our conversation, and they said, yes, I did all of this, and then I got tired, and I knew that if I will continue doing this, I'll end up XYZ, not in a good place. And I did this, and I did this, and I did this. And some of the things they told me, a very young person, under 20, I listened to them and I had tears in my eyes, and I said, you experienced this and you still did this? For the sake of confidentiality, I won't tell any more details, but their story, what they did, took over the room. And I think that's a skill for us to let their own inner light shine through us, through the therapeutic space. That's a skill I'm looking if we can have. There's no sort of a training for it. There's just sort of a readiness and openness for us that we need as therapists.
What are the most common obstacles or missteps that prevent therapists and patients alike from seeing the full benefits of positive psychotherapy?
There are many. Most common obstacle is we all inherited a brain which, unfortunately more than fortunately less, doesn't look at the world as a very benevolent place, because from an evolutionary point of view, our brain developed to scan the dangers on the horizons in the savannas of Africa and then marshal our defenses to see how we can defend. So we pay much more attention and effort to negative or information. So let me give you a concrete example of the obstacle which might a clinician encounter. And an average person, they receive 4 compliments or 5 compliments from a sincere friend. And because the friend is sincere, the sincere friend may also give you negative feedback. So when you're driving back home or coming back home or next day in the shower and you're scratching your head, and you might have forgotten all the 4 compliments, but you're still stuck at one negative thing, one negative feedback. So our minds are skewed towards negativity. So when our clients' minds are skewed way too much towards negativity, that's an obstacle. So you may need a bit of a more room to clear the weeds. And it may not clear with just one intervention. So you want to exercise more tolerance, more patience to offset or to shake their fundamental negativity bias, as we call it. So that's one, because the clients coming for therapy, they experience many more negative emotion than positive. Ellen Waterman's research shows that. So that's one. Secondly, we also need to be very mindful of the cultural context and the environment they live in. You are working with one person, but that person is situated in a larger social, cultural milieu in which they may not be able to change a lot of things and which might impede their therapeutic progress. And I'll give you a case example. Number of times I've been noticed, and I'll give one specific one example is I work with lots of young females. Part of the therapy is also to explore their strengths. Oftentimes, their strengths, especially when they're depressed, their strengths are love, social intelligence, forgiveness, humility, and prudence. And yet they have been depressed for a long time. So if you start asking them questions, these strengths are actually being counterproductive because they're overusing forgiveness. Even the things where there should be anger is not always bad. Anger has adaptive mechanism. So when someone is using their goodness too much in situations or with people in the context where they can use other strengths, that is also a barrier to therapy. So you need to sort of unpack the usage of their strengths and symptoms. You cannot use forgiveness in all situations. Likewise, even sometimes you cannot be grateful for everything because it may turn into complacency. I mean, very rarely, gratitude is a master strength, and I endorse it in almost most situations, but it's the contextualized use of that strength is important. The third barrier towards the effectiveness of the treatment is our clients have been socialized. If you ask our client, what do you mean by therapy? Oh, therapy is a place where I go and where I vent my anger, where I discuss all my problem. So our clients have been raised on this steady diet reinforced by media, inaccurate portrayals of psychotherapy in media, in films, and in other places, that has given them this message that therapy is not a place where they grow. Therapy is a place where they vent, where it's a place for catharsis. Of course it is. But it can also be a therapeutic, we can create a therapeutic milieu, a therapeutic space where both client and clinicians can grow.
That's a really good answer. I really like that. So who is positive psychotherapy not appropriate for?
The positive psychotherapy is not appropriate for someone who comes with a history of abuse and they need a space to first explore, to unpack the ill adverse effects of that abuse, because it has sort of seeped into their spirit and psyche and soul and injured them to a point that they need lots of gentle care. You don't want to use the typical traditional exercises. When I say exercises, these are just, I actually use the word practice. Those practices have their own time, their own appropriateness. So in abuse situation, no. Someone who has, let's say, symptoms of panic attack, symptoms of specific forms of phobia, and character pathology disorders. We do not have evidence for these conditions that it works, so I would not advocate that you should use that. Secondly, also, it's the readiness of both client and clinician. And if you suggest something and clients say, no, I don't use positive psychotherapy exercises, even concept with some clients who just want to vent their frustration at traffic or weather or about politics or about many other things, because you first make the space. There is always a possibility that you can insert a little bit of genuine appreciation for their effort and or something that they shared with you to nudge them, to point them out towards that. But honestly, I would say that too has to be done very carefully and cautiously. You can have the best treatment, but if the best treatment is forced upon client without understanding their life circumstances in the moment, it would not go well.
Since positive psychotherapy is so universally helpful to maintaining mental health, wouldn't it be useful to teach positive psychotherapy concepts to young people as a preventative measure?
Absolutely. We have thought about that, and we will have been lucky that we took this approach to school. Before working at university training, I worked as a school psychologist in school settings. And when I brought the notion of positive psychotherapy, they said, do not use the word therapy here. So we adapted the program and we call it strength-based resilience. And you can find the link. It's strength-based resilience, oneword.com. And we use a similar, most of the exercises and practices are similar, but included more mindfulness, a bit of more cognitive themes in it. What we did is we turned into a curriculum, and we've been fortunate to receive a grant and ran a curriculum in a number of high schools and trained teachers to deliver the training or this course and gave them a lot of leverage in terms of teaching it either in a careers class, either in a life skills course in high schools. Some experiments we have done, studies have done in middle school, and most of the time the results are very promising, or the reception is quite promising, because I don't think so mental health is mental illness. Mental issues are just a psychological problem. Mental illness is a social issue, and it needs broad-based, socially, ecologically informed solutions and approaches and interventions. So the more we can embed these concepts in our education, in our health practice, in our work practice, the better it would be. And I end this answer with a small case illustration. I was working with a student and they had tons of intake. They listed so many issues that you can imagine that how a young person in high school can encounter these and deal with all these issues. And when I met with them, I said, after all of this, how did you survive? And you're sitting in front of me. And they said, one day I was in a very bad place and I've done this, and you can think about all the negative things to a point that they have to leave their home. And one day I was alone and crying and had no one around me. And I looked at the sky. The sky was blue and it was the dead of the winter and there was snow all around. And I started crying and I said, if I kept on going like this, I would never be able to see another blue sky. I just went to someone who was able to help me and then find the next person and next person and next person. And even the years that I've missed in the school, I made up for them. Here I am. And this conversation was taking place in the dead of the winter, and there was a snow outside. And I pointed out, look, there's snow outside and the sky is blue. They smiled at me and they said, yeah, and I'm very grateful that I'm sitting here. That day, they started a journal of noting the good things in their life, small little good things in their life. Believe me or not, the journal, they named it when they came next time to see me. It's called Blue Sky.
Wow, that's incredible. If you had a magic wand and could improve one thing about mental health treatment, what would it be?
I would like mental health to be part of our education. So it destigmatizes. Also, it builds the mental health literacy, but mental health which is more balanced, which is more holistic, in which we teach our young children and adolescents and even adults that life is not only about genetic accidents and that you have to sit on those genetic accidents for the rest of your life. Life is about how to get over them by utilizing assets, the resources, the virtues, the strengths, the abilities, the talents, the divine or whatever natural providence that you believe in. And life is about discovering and using this to make our inner climate more peaceful. And once we make our inner climate, our inner land, which is encroached with these worries of materialism, of having this and that, we become more attuned with our real self. And once we are more attuned with our real self, we are more prepared to see the goodness which is in others. Right now, Bridget, there are thousands of more people who are helping each other than hurting there. There are thousands of parents who are preparing food than someone who is stealing that. There are hundreds and hundreds of more people who are helping the injured and sick than people who are hurting them. So I think that's the beauty of life. This is why we are here. This is why you and I are talking about these issues. This is how the circle of life has continued. So I think we need to bring that circle of life into our education, in our schools, in our communities, in our synagogues, in our mosques, in our temples, in wherever we may find a natural home for that.
Thank you, Dr. Rashid. I wholeheartedly agree with you. And that is exactly what we are trying to do with this podcast, to shed light on programs like strength-based resilience that we know work to not only treat people with mental illness, but to also be utilized as a protective factor before there is a problem. So if you'd like to know more about Dr. Rashid's contributions to the fields of positive psychotherapy, there will be links to his work in the show notes and an entire page dedicated to positive psychotherapy on www.therapyshow.com. And I'd like to add that the Strength-Based Resilience website is extremely easy to navigate and has many resources, including lessons on subjects like empathy, positive communication, problem solving, and many others. These are all valuable lessons for living for both young people and adults alike. So Dr. Rashid, on behalf of myself, my listeners, and all of the people that you have helped through your work, I want to thank you for your contributions to mental health treatment and for taking the time out of your busy schedule to help me and my audience better understand the fields of positive psychotherapy. And I'd like to close by reminding our listeners to please subscribe, share, and review this podcast so you, someone you love, and people around the world gain more benefit from therapy. There's no need to suffer in silence. Get the help that you need and create the life that you want.